Hey everyone, it's Dr. Shridharani here in New York City at LUXURGERY. I'm really excited to be sharing some amazing news with you in the world of aesthetics, aesthetic plastic surgery, because we now have the world's first FDA-approved injectable to help improve the appearance of cellulite. It's a pretty amazing time to be involved in aesthetics, and it just got FDA approved today, and it is called QWO. And you may be saying, well, what exactly is cellulite and what is QWO? So first of all, cellulite is actually a really complex, multifactorial process and a problem that bothers a lot of men and women, but primarily women, in specific areas of the body. But pretty much it's fat, more or less, that's been trapped by these things called fibrous septae, which partition off specific parts of the fat, and those septae are basically comprised of certain types of collagen. And basically it leads to a less aesthetic overall contour of certain areas like the buttocks, the posterior thighs, some of the arms, outer thighs, a lot of basically the lower extremity. But nonetheless, it's a really exciting day. So if you're wondering, well, what is QWO? QWO is actually the world's only FDA-approved injection to help improve the appearance of cellulite. And it's basically what we call CCH. If you're wondering, well, what is CCH? CCH is collagenase Clostridium histolyticum. And it sounds a bit like a mouthful, and it kind of is, but effectively, collagenase is an enzyme that helps break down collagen. And we want to keep collagen in certain types of the body, in certain parts, but we want to actually break up the fibrous septae, which are primarily comprised of collagen, which are creating those tethers, those anchorings. Think of like a quilted mattress or the tufted Chanel bag, right? That kind of resonates with a lot of our patients. But basically, those areas that are going to pull down on some of the skin. So collagenase Clostridium histolyticum will help enzymatically break down specifically types 1 and 3 collagen when we inject it into those dimples on the buttocks. So again, a really, really exciting time in the world of aesthetics. So that's basically what QWO is, and that is what CCH is. So a lot of you might be asking, well, is QWO safe? So QWO has been studied all around the US by individuals like myself and colleagues who are principal investigators in clinical studies. So we did a lot of the FDA clinical trials here at LUXURGERY, so I have a lot of experience with QWO when it was still just known as CCH. And basically we found it to be extremely safe. We've done a lot of treatment cycles on a lot of patients and followed them for a significant amount of time. And we know from all the excellent data that we can see a pretty substantial improvement in the appearance of cellulite. Patients are getting longevity for quite some time. We don't know exactly how many years yet, but nonetheless, it's a really exciting time because we're going to be having that continued dialogue and data and keep watching our patients. But again, what's exciting is that it's FDA approved and it's something that we can start to be treated with. So a lot of you may be wondering, well, when can I have it? This sounds amazing. I want to get rid of my cellulite. Well, effectively, although it's been FDA approved, we know that it's not going to be commercially available until probably spring of 2021. So we've already had a lot of interest in our own practice because, again, we've injected a lot of patients in the clinical trials and studies with it, have a tremendous amount of experience and continue to follow its progress. But nonetheless, we can't start using it on patients every single day type of thing until spring of 2021. And rest assured, we here at LUXURGERY will be out on the forefront of having it available for our amazing patients. So some of you also are wondering, how is it administered? QWO actually is administered as an injection, much like our neuromodulators, things that you may have heard of like Botox, Dysport, QWO, Xeomin, or even Kybella that a lot of you guys know that we have a lot of experience with here in our practice. So it's a clear, odorless, water-like solution that we effectively get to inject with tiny, tiny needles, much like our toxin injections. And so we get to help get rid of that cellulite appearance with small injections. As mentioned, we do have quite a bit of experience here in our practice with it and look forward to being able to treat you all with it. After the treatment itself, what to expect? Having had the benefit of treating a lot of patients and tracking their progress several times over the period of several months, we know that the first treatment is hallmarked by a pretty big bruise. I often tell my patients, don't be surprised if you look like you fell skiing or something like that, because it's not going to be as painful as that by any means, but you're going to have a pretty sizable bruise. That's a normal part of the process. You can talk more about how or why that occurs, but bigger picture is just expect some social downtime. You'll be a little bit tender as well in the injection site, but nothing that my patients require anything more than some Tylenol or ibuprofen to help alleviate some of those normal symptoms. Now, a bruise again can last a couple of weeks, so if you're planning on doing this and going on your beach holiday, I would tell you either plan well ahead of time for me to help get rid of that cellulite before you're going to be in your bikini, or wait till afterwards. After I treat patients, it usually takes a few weeks at the earliest to start seeing some changes. So patients get treated in cycles. So what that means is that we typically space these treatments maybe around 3 to 4 weeks apart. In the clinical studies, so we did it roughly around 3 weeks apart, and patients start to see an improvement, some of them as early as that 3-week window, even after the first treatment. But with that said, most patients are going to require anywhere from 2 to 3 treatment cycles spaced a few weeks apart. And what I do know is that with each subsequent treatment cycle, the swelling and the bruising and a little bit of that downtime significantly started to decrease. We just got to get you through that first treatment, and then you're going to do great. So several of my patients often ask me, is this the only time we've had an FDA-approved injectable form of CCH, or that collagenase Clostridium histolyticum? The answer is actually no. We've had a drug called XIAFLEX, which has been FDA approved for several years, primarily for the indication for what we call Dupuytren's contracture of the hand, something that afflicts typically men more than women, and it creates a scar contracture on the palmar surface of the hand, leading to a flexion contracture. So we've been able to use this to inject to break down some of the scar tissue that creates that contracture. Men can also be afflicted with something called Peyronie's disease, which is actually a type of fibrosis or a scarification of the penis. And so this injectable form of that has been able to help patients get through that disease process. So the fact of the matter is we've had an injectable form of CCH that's been safe, FDA approved for years already. This is a different formulation of that compound, but I think it's really exciting that we now have something that's specifically designed to help patients that are bothered by that cellulite appearance, kind of that cobblestoning, or just the not smooth appearance of certain parts of their body and the dimples. So this is, again, a really exciting time in the world of aesthetics. Again, this is Dr. Shridharani in New York City, and we are so excited to be able to tell you all about QWO and what is something that's going to be in our offices to help all of our patients, current and new, who are bothered by cellulite. We love being on the forefront of treatments and technology. So just remember, you heard about QWO from us today, the day it got FDA approved.